In this all-hands-on-deck situation, doctors and medical professionals of all stripes are being told their help may be needed in emergency rooms, especially as staff on the front lines start to get sick themselves. Dr. John Boockvar is vice chair of neurosurgery at New York's Lenox Hill Hospital. He is with us tonight. Doctor, it's good to have you with us.
Good to be here. Thank you.
How are you feeling this evening about what's happening in our nation's hospitals from those you are speaking with and the things you've seen yourself?
Well, frankly, we're scared. The whole healthcare industry is scared. We feel that we're not prepared from a protection equipment perspective. And frankly, once that gets put into place, we'll be ready, willing, and able to provide the protection that the American public expects for us. We are being asked to cross-credential. For example, I'm a neurosurgeon. I've been asked to cross-credential in critical care medicine and emergency medicine. In case my colleagues go down with sickness or quarantine, I will be pulled to man those locations.
So you're going to have specialists in other fields being pulled literally onto the front lines?
Yes, and that happened as early as today. We had a nurse practitioner in our neurosurgery practice get asked to be deployed out into a swab facility in Brooklyn, something that she is not trained or accustomed to doing. She's more than willing to do it. We will all sacrifice and do whatever it takes and cover any locations necessary, but you're going to be seeing emergency rooms and critical care units staffed by specialists and other physicians.
Are you feeling better about the testing that we're doing now than you were days and even just a week ago?
Testing is only one component. What I think is absolutely necessary is the federal government's involvement with the Army Corps of Engineers and the Defense Production Act. We have 2 weeks to make a dent in this fight. This is a war. There should be a declaration of war at the federal level, starting in New York City, starting this weekend. We need to open the Javits Convention Center now. We need beds now. We need the 15,000 ventilators in the federal government repository shipped to the coast now. And then we'll wait for GE and Siemens and GM and Chevy to produce the ventilators. We need them now. We need them tomorrow in our hospitals. Our ICUs are filled now.
Can you tell me more about this 2-week time frame that you just mentioned?
So the 2-week time frame, and I look at this as a very, and some of your guests have said the same thing. This is a pivotal time in American history. We need to be on social distancing and social isolation to make sure that we can handle the surge. The surge is happening now in New York. Our hospitals are overflowing with COVID patients. Our ICUs are hitting maximum capacity. If we don't increase the number of beds in New York City, we will go over healthcare capacity. We need the Army Corps of Engineers to open facilities this weekend. We need Rosie the Riveter to be working on production of masks and ventilators this weekend. We have 2 weeks to catch up. While the nation is socially isolated, we will get the healthcare system and providers ready to battle this war.
Dr. Boockvar, thank you for being with us tonight. It's nice speaking with you.